My name is Teri Dreyer. I'm the founder and president of NShore Patient Advocates. I've been an ICU nurse for 38 years. In 2011, I started NShore Patient Advocates after we had a family health crisis, and my eyes were kind of open to what the general public struggles with when they're going through an emergency. And after our emergency was over, I thought to myself, what do people do out there when they're trying to navigate complex health issues and they don't have a nurse or a doctor in their family? It's a confusing time, and it can be a really dangerous time. So I've always been a patient advocate as I've worked in the hospital all these years, but my real joy and my real pleasure now comes from helping people in the private sector navigate complex health issues. I just love to come alongside people and help them with a wide variety of different things, either finding placement for aging parents or finding doctors that can meet their needs or finding assisted care facilities for their parents or themselves. And sometimes I help people actually in the hospital.
I had a medical emergency a few years ago where I had blood clotting problems in my legs, my lower body, and it got so severe that it caused me to pass out. So I called my nurse advocate who I had been seeing for some time before that. She took me to the emergency room at the hospital. The doctor at the hospital looked me over and decided to give me some type of medication and send me home. She absolutely refused to have me go home, insisted that I had a more serious problem. So they admitted me. The next day, they brought in the specialists who they determined needed special expertise to clear the clotting out of my blood veins, out of my legs. I had numerous severe surgical procedures to finally get this process corrected, all the while under the guidance of my nurse advocate, with whom I would, they tell me later, probably have died. So I'm very thankful that she was available to me and that she was there to interpret the medical procedures for me and help me make my decisions.
I am glad she was there too, because I was clueless. I knew he had a problem. I am not a medical person. I'm a wife. He collapsed and I said, well, I wonder what I should do. So I was very thankful she was there to interpret that. I'm sure I'm not the first person in the world to face that. I'm sure there's all kinds of people out there doing what their doctor says, and they don't know, is it right, wrong? The doctor isn't wrong, but somebody needs to help them make any decision. So I'm glad my nurse was there.
So it's a confusing world out there in healthcare right now, and though I originally went into private professional patient advocacy for the patients because I just love having that one-on-one personal approach with patients, what I've also found is that what I do really helps hospitals and physicians as well. Hospitals right now are in fierce competition to reduce hospital readmission, and if they can't justify a particular skill to have a home health care nurse follow somebody after they go home, I think it's a really excellent option to have a private patient advocate come alongside and help monitor that patient and make sure that they don't go back into the hospital within the first 30 days. That saves hospitals just multiple thousands of dollars, hundreds of thousands, if not millions of dollars per year. And so I think hospitals have to start thinking about being creative in today's world of healthcare. I also help physicians. Physicians love having me on a case with one of their patients because it's like having a mid-level practitioner watch over their patient, and they don't have to pay. The patients pay me, and that's an allegiance issue for me. I don't work for the insurance company. I don't work for the hospital. I don't work for the doctor. I work for the patient, and I treat that patient like I would my own mom or dad or family member, and I take a real personal interest, and the nurses that work with me take a real personal interest. NShore Patient Advocates is a full-service patient advocacy organization. We don't just come alongside patients as a nurse, but we also have very, very high-quality, skilled billing experts that can help navigate complex insurance issues, can deal with insurance companies that are not paying for things that they should be paying for. And we really help people make wise choices. We have the ability to go behind the scenes and find out the real scoop on hospitals, physicians, specialists, and get the absolute best quality care and facilities that are out there today. So we're all about protecting the patient and treating them just like we would our own parents.